Why do doctors sometimes force labor to start without waiting naturally for it to start on its own? Is it necessary or can it be avoided? Hello everyone, my name is Lucy. In this video, I'm going to explain the real medical reasons behind the induction. I have 10 of them. Number 1 is post-pregnancy. When you've carried your pregnancy up to 40 to 42 weeks, it is always advisable to go for induction because at that stage, placenta might start reducing its work, and when it does that, the baby's well-being is compromised inside the uterus. The second reason is when there is water break, which is rupture of membrane. Whether you are in labor or out of labor but your water has break, there is need for induction to commence, because if you just leave that person that way, infection can set in. So in order to avoid that, induction is being initiated. Number 3 reasons why you can do induction is when that woman is having high blood pressure. Some women don't have high blood pressure, but once they have taken in, you see the blood pressure shooting up. This can progress to a preeclampsia, and sometimes it comes with seizure, and it is always life-threatening to both the mother and the child if not managed well. So at a point, it is always advisable to initiate induction so as to deliver that baby for the safety of both the mother and the child. Number 4th reason for induction is when there is maternal health problem. If that pregnant woman is anemic, or she is having a heart disease, or she is diabetic mother, the pregnancy might not be allowed to reach term before induction can be commenced. Then number 5 reason is what is known as intrauterine fetal growth retardation, when the baby stop growing. At 6 months, the weight of the baby is the same. Then when it has reached 7 months, it still remains the same. Then moving forward, baby is not putting because it is from the weight you will know if baby is growing or not. And when you go for a scan, you will see that baby weight remains the same. In that case, there is something that is making it to be so. So in this scenario, induction is being advised, because whatever it is that's making the baby not to grow is not healthy for the baby if the baby continues to stay in the uterus. Another reason why induction on labor can be done is when there is low amniotic fluid, which is also known as oligohydramnios. So when it happens, it can cause cord compression. It can also cause fetal distress. In this scenario, induction is advised. Number 7 reason is when the baby dies in the uterus. Yes, if the baby unfortunately happens not to be breathing, maybe you go for scan and you notice the baby is no longer there, next thing they are going to do is to commence induction for you to deliver the child. Number 8 reason is if the uterus is infected, then induction can be commenced so as to deliver that baby. Our number 9 reason is placenta insufficiency, and this is one of the basic reasons why induction is being advised when you've carried your baby to 40, 42 weeks without having any signs of labor. When the placenta is not doing its works, it will not be supplying both nutrients and oxygen to the baby as it should. So if baby continues to stay in the womb, that baby's life might be threatened. Then the last reason is on request. Some women also request for induction even without any medical issue attached to it. But if you must do this, please always make sure that you've reached 39 weeks plus before you can request for induction. If you watch this far, Thank you so much for watching my video. Please do well to like, and if you have any comment or question, please drop it. I'm going to answer it. One thing I want you to know is this: induction is not done randomly. So before you go in for induction, please make sure that it is medically inclined. And induction is done if carrying that pregnancy is more life-threatening than delivering the child. You see, your doctor or your midwife will always propose you go in for induction. Share this video to someone that will like it, and do well to follow me for more.